What's up, everyone? Welcome to another Q&A session with myself, Dr. Tan, the survival doctor. And today we're talking about some of the questions that you submitted about bleeding, about cold weather survival, and how the heck do I stay warm living out of my truck when I'm doing these long rural ER shifts. So without further ado, let's get into it. Hey everyone, welcome to the Survival Doctors Q&A session. We have this towards the end of the month, every single month, for both our students and our private community, and you, our devoted followers. For those of you who are new, welcome. Let me know in the comments where you're coming from. And for our students, thank you for showing up and learning and dedicating your time, your precious time, into learning how to save lives and to be as independent and self-reliant as possible. It is really heartwarming to see that in different communities. We have people coming in as preachers, as community members who are educating their people that they care about so that they can go out into the community, into their work, into the woods and all their adventures and be the person that is the type that makes sure people come home safely. And that is our mission here at Survival Doctors, to train as many people as possible, not only for our adventures, but for our unforeseen emergencies. So thank you all for tuning in and checking out this Q&A session. So if you're just chiming in, I see a handful of people. Let me know where you're coming from. And also let me know, what is your biggest question about anything medical, anything survival? No questions are out of line. You are having access, direct access to a doctor right now. So whatever medical question, however weird or strange, let me know. If I don't know the answer, I will be very frank about it and say I'll have to answer that in the comment section. But if I do know the answer, you got it. So a little bit about myself. I am a rural ER doctor trained in family medicine, emergency medicine, and wilderness medicine. And I love improvised stuff, whether that's a survival situation, whether that's something that you have to make to address a medical problem, and also thinking about the human body in a way that allows you to understand what you need to do to make those medical decisions in a very different environment. Because even though you're a doctor, even though you're a nurse or you're a medical professional, it just takes one change in context that makes that situation very different. We see that in the case if you're trained at a big city level 1 trauma center, and then you go out to a critical access hospital like the one that I work at, and you just don't have the equipment, you don't have the staff, you don't have the specialties, you don't have the backup, you don't even have a radiologist reading the images that you order. So really, the switch of context is key, and we see that from civilian to military, and also civilian military into the wilderness medicine as well. Got some people, Jen Gemini from Indiana. What is the health benefits of heavy metal music? So it does get you pumped, doesn't it? Does increase your heart rate, and if it's something that resonates with you, all good for that. I don't know the research behind that, but I do know research behind one song, and I'll pull it up for you guys. I won't play it, but I do have this on my Spotify. And the reason why I have this on my Spotify is because it has evidence to show relaxation. So there was a study that looked at a medication that relaxes you. So in the benzodiazepine drug class, and this was for like pre-op kind of surgeries. So this is the person that may be a little anxious coming into their operation, and they're either given a medication to have them relax or this music. And this music, I think it's like a 5-minute loop. Let me put it in my library, and I won't play this, so don't worry. So it is called Weightless by Marconi Union. So that's Marconi Union, Union. So there's actually research that supports that this music does something to your psyche, whether it's the frequencies, the zone of meditation or wave frequencies that you go into when you're listening to this in a peaceful mindset actually decreases your anxiety level. So I think that's really, really cool. But other questions that were submitted was related to wound care. So we have someone who submitted a question. Hey, what is the way to treat someone with hemostatic agents? And this follower of ours mentioned two types of products that he owns. One's a powder, and one's a hemostatic agent that's impregnated or kind of fluffed into some gauze. So those are two options. And within a hemostatic agent, if you don't know what a hemostatic agent is, this is what it is. A hemostatic agent is something that works with your factors in your body, whether it's in your blood or your platelets or making blood a little more goopy, and it slows down that bleed because it acts as a factor that stimulates your blood to either be thick and gooey or help it clot up and plug up some of those bleeding sites. The interesting fact I would think in the last few years, the last, I would say, 5 years of research, is that some of these options show increased benefit or a decreased mortality. So less people are dying when you use this product in a massive bleed. So that's recent information. And I don't remember which product it is, and I'm not sponsored by any of these hemostatic agents, but I do include it in my Stop the Bleed guide. So if you're interested in that, comment Stop the Bleed in the comments, and I'll send you a link to the guide. It's free. You can download it. It's like 16 pages, and it's the updated TCCC guidelines plus some benefits and tips from my work as an ER doctor as well. So it's a really good guide. One of our longer guides, and I think it really represents the quality that we put out there on a monthly basis with our new guides. So if you're interested in that and our other guides, comment field guide. So hemostatic agents, there are powder related ones and gauze related ones. Now the powder ones, I would stir away from that for a few reasons. Number one, we used to use it way back when, and in a stressful situation, you're already a little jittery. It might be your first big trauma, and to open like a jar of this stuff, and it's kind of like powder. So think about like a cup of flour that you have to screw off. It's going all over the place. You may be shaking. You may put it down a little for a while as you're getting the bandages ready. It may get knocked out because your patient's in a lot of pain and maybe delirious. And in addition to that, you have to, in these situations, you're often packing a wound. So you're packing gauze, like I have some gauze over here, and you're packing that into the wound. It's a very painful process. There's a lot of kicking and screaming, and all at the same time, you're supposed to kind of like mix this powder into it. So not the best logistically. Now, the ones that have the gauze that's already in there, it's as easy as packing the wound. So if you're interested in learning how to pack a wound, again, Stop the Bleed. I'll send that field guide your way, and we also have videos on it as well in our private community. So highly recommend the gauze and knowing the differences between the hemostatic agents, because not all hemostatic agents are the same. Some hemostatic factors work on coagulation factors. Some work on the viscosity or the thickness of your blood. So it works differently. And the reason why I bring that up is because some people, like one of my best friends who's living out in Georgia, they have a coagulation genetic issue. So even if you have that hemostatic agent and you give it to them and they're bleeding, it will not work because they're missing that factor 8. So really important to note when you're picking your hemostatic agent. But at the end of the day, one of the most potent things that you can use, medication or not, is pressure. So if you have nothing, pressure, 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 and know when and how to make a tourniquet and apply a tourniquet. Gemini, been a metalhead all my life. Saying that it helps. No problem. It was definitely an interesting question, and I'm sure there's functional MRI studies of different music because they are mapping the brain as well. So that was his question about hemostatic agents. One of the requests that I had from a follower was, how do I, as a doctor, function at that level of kind of, you need to function as a doctor, an ER doctor, doing procedures, responding to codes, bringing people back to life. How do you do that and still sleep in sub-zero temperature with no heat at night? So that's the main discussion here. And for those of you who are just chiming in, write your questions and your comments in the chat box, and we'll be able to answer that live too. So it all comes down to what we choose for layering, and in a winter camping situation, what do we use for moisture control as well. So the main thing when we're thinking about winter camping is insulation, 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 right? I have the benefit of sleeping out of my truck most nights when I'm on call or going to a shift that's like 2 hours away from me. So I do have cover, so a natural break with the wind. That's my Lear cap. It's like a high top Lear cap where I can be on my knees. And what I have is like a 4-inch pad that's memory foam that's really comfortable. And to make it super warm, I have my minus 40-degree sleeping bag. And even with the minus 40 sleeping bag, it's not, you're going to be comfortable and have a great amount of sleep at minus 40 degrees. And I believe minus 40 degrees Fahrenheit is very similar to minus 40 degrees Celsius. So very, very cold. And I would say like even minus 10 Celsius or like what would be the equivalent in Fahrenheit? Probably around like 0 Fahrenheit or something like that. You still feel slightly uncomfortable in a minus 40 bag at that temperature. It's not the same as you falling asleep in your bed right now. It is a little chilly. So some of the things that I use to make that bag even more warm is I have two things. So a two-layer system on top of that. One of them being just a fleece blanket. I believe I got it from Costco. It doesn't cost a whole lot. And then on top of that, I have something that's we call it a whoopee blanket. So it's super lightweight, synthetic, and often used in the military, and a lot of Marines use it as well. It acts as almost like a blanket and a parka, not a parka. What's the right word that I'm looking for? Poncho can be used as a insulated poncho, and then you can fit your waterproof poncho on top of that. But it also doubles as a sleeping bag and or a quilted blanket. So I use that two layers on top of my sleeping bag, and the reason why I include a fleece on top of that is because there's a lot of moisture in that enclosed thing. Think about being inside a tent. If you ever slept in a tent that it was cold and maybe raining, the inside has a lot of moisture. So when I have the sleeping bag near my face, oftentimes there's a lot of moisture there. So instead of having it on my sleeping bag material, I have that fleece blanket around my neck and my face, so that traps and distributes a lot of that moisture there. And for additional moisture control, one of the things that I did and modified in my truck is that in several places on my truck, there's just these metal washers that I super glued to the ceiling, and I have these magnets with these really strong magnets with string on that, and I'm basically getting like a white double size or queen size sheet, and I'm putting that up there and attaching it with those little magnet strings. And what that does is two things. Number one, it adds an additional air barrier. So whether it's minus 10 or minus 40, I'm still cracking a window for air circulation. So I'm having zero heat, zero active heat. I have no electricity in there. I have no heating systems in there, and I don't need it. I actually sleep fairly naked in there. And the one of the reasons is because I have like a mini shelter inside that shelter with that sheet air gap. And in addition to that, it acts as a moisture kind of barrier as well. So the reason why I chose that material is it's very cheap. You can buy like a cotton sheet or find one at the thrift store for basically nothing, like a few bucks. And it does provide that air gap. And if there is moisture, it isn't dripping down on you. So one of the biggest mistakes or the biggest problems when you're in a tight enclosed space like that with moisture is as you're getting out, because you'll probably pee a few times over the night if you're anything like me. And the moment your head or your clothing or anything like that touches any of that tent material, or in my case, truck bed material, that's a lot of moisture. And it just soaks up whatever you're wearing very, very quickly. Now with that sheet, that doesn't happen. And that I typically stay out there for like 5 days at most, and that sheet never becomes an issue where it's like dripping or icy or anything like that. So it's a really good option because during the day when it's super sunny, my Lyric cap is black, heats it up, and a lot of that moisture inside that sheet just evaporates. So really good option. And the last thing that I would say is how you protect your head and neck. So one of the things that were issued in the military is this white balaclava type of thing. It looks like a white, like you're gonna rob someone's ski mask, and it only has openings in the mouth and around the eyes. Everything else is covered. That is the most cozy thing that you can get. And even on top of that, I would have like a wool beanie or toque, and I would roll it down all the way up to just where my nose is. And then I also have a neck warmer as well, and I put it up to where my mouth is as well. With that setup, your face feels pretty well insulated. You're not having a lot of that chill, and you're able to have a very comfortable sleep. When I'm sleeping out there, whether it's like really, really cold or snowing, like I have some of the best sleeps that I have out there. Way better than if I were to go in a hotel that I don't know with scratchy, bleached out bed sheets with possible bed bugs and people running in the hallways and that type of thing. I have a way better sleep in that setup. And the last thing that I would do is if it was extremely cold. So last year, I think it was like late in the season, we had a very cold spell where it was, I think, as cold as like -20 without the wind chill. So probably colder with the wind chill. And what I would do is, last thing that I would do before I leave the hospital is I just have this metal canteen. And with that metal canteen, it's single walled, so non insulated. I would just fill it up with hot water and then, like, not all the way to the top, maybe like 3/4 of the way, screw it tight, and then just put it in my sleeping bag. So I would throw it in my sleeping bag, go out to dinner, and by the time I'm ready to go into bed, my sleeping bag's pretty toasty, and that stays warm for several hours. So I think it stays warm up until like 3 or 4 a.m., which is perfect for me because by that time I'm fairly toasty inside. And one of the big changes, and I think this is a shift for myself, but also gives a little bit of context and nuance into that whole debate between should I sleep naked versus should I not sleep naked and wear all my clothes inside. So let me add a little bit of context there. I would say if you are long term camping, or if you have no idea how long you're going to be in a survival situation and it's dry and cold. So I'm thinking like -15 below, very dry snow, not wet. I would recommend keeping your parka and your outside clothes outside so it stays kind of outside that moisture area, because over time, if you're bringing it in and out of your tent setup, especially if you're having heat in there, that will cause a lot of moisture to trap within the material, and it's very difficult to dry out. Versus if you leave it outside, it stays cool even if there's some moisture from sweat. In the morning, you can shake off that frost and it will insulate really well, better than if it were inside your tent and trapping in all that moisture. Number two is, let's say if you are I lost my train of thought. So let's say if you have a long-term survival situation and you're looking for, let's say, let's let's switch gears because I think this topic is something that one of our students mentioned previously. So what I do want to talk about is ice safety, because that was another question that someone brought up too. So a question that someone brought up was how thick, and we had one of our students go out, and they were out on a camping YouTube expedition, and they were questioning how thick ice should be to safely walk on it because they were camping on top of ice. Yeah, Ryan's here. Awesome. Ryan, why don't you let us know how thick the ice was on your setup and what you guys used, because it was cold. Ryan's from Canada, and he has a YouTube channel. Go check him out, Ryan on the Run. And he was out last weekend in the really cold temperature, so cold that some of his equipment was not working. But he is saying that the ice on the lake was 8 inches. 8 inches, very safe, especially if you're on foot. I would say that would be like a kind of a bare minimum for like snowmobiles in my kind of comfort zone, and anything like over a foot would be pretty darn safe. Minimum 4 inches, as per some of the guidelines out there, but for me, that 8 inches very safe to go on. Ah, Ryan, you got a follower in here? Looks like they know you. But yeah, guys, let me know what your questions are about cold related stuff because it is very, very important that you keep warm. One of the fatal things that can happen is when you get really cold, it comes to a point where you don't necessarily know how dangerous it is because it is a very kind of sneaky pathology. It is something where you get a little sleepy, confused, maybe irritable, a little sloppy in your techniques, and that's something that could either get you injured or put you in a sleep that you don't necessarily wake up from. So, what is the main thing to look out for? And we have a really interesting story that I just interviewed one of our chief fire department friends who worked on a case in Alaska. And that was such a crazy case that I'm so excited to finish editing it and showing it with you. But what's the main thing that distinguishes I am cold versus I am cold and this is an emergency? Ooh, also a really good question. So I'll let you guys think on that one. Let me know in the comments what you think distinguishes cold and cold emergencies in regards to your core body temperature, and we'll get on to this question over here. What is the fastest and safest way to warm up from frostbite? Great question. So, number one, what is frostbite, and what can be some things that happens with frostbite? So, frostbite is a cold injury. Typically, it can be from freezing cold, or it can be like a blood vessel inflammation type of process where it's a non-freezing injury. So, think about trench foot. Think about maybe around 50, just below 15 degrees Celsius. Let me know in the chat what that conversion is in Fahrenheit, but definitely above freezing temperature. You can still get cold injuries as well. But for this situation, let's just talk about cold related injuries where in the field it's hard to distinguish how deep the frostbite is initially because it can take time to, let's say, develop blisters, and it does take time to know if that tissue, let's say your fingers or your toes, are completely dead or not. Because sometimes you'll be surprised, even though that some of your fingertips or hands may look a different color, but then a month or two in, you actually have more healthy and regenerated tissue than you originally thought. So that's why they don't amputate it immediately. But the fastest and safest way to warm up frostbite is through a circulating warm bath. So in the hospital, we have something that if you're in a hospital that deals with a lot of this stuff, if you're in like a rural hospital like the one that I have, we probably have to jerry rig something like that. But circulating warm water is the thing that you would want to do. But that would only be the case if you have zero risk of refreezing that injury. So it's not the case where you are out on an adventure, you feel like you're getting frostbite, you don't have a shelter set up, you don't have any way to keep that hand or feet warm after you originally rewarm it, then you do not want to defrost it. If you do that, same thing, very similar thing happens to people who turn on and off a tourniquet. If you do it on and off, thinking that, hey, we're going to give it a little bit more blood and oxygen and then shut it off so you're stopping the bleed and the stop and go. Same thing that happens, or very similar reactions that happen with defrosting and freezing. If you do that on off action, there's more tissue damage, there's more tissue death, and we call that refreezing injury. So you don't want to do that. So the once you have that definitive shelter, you know for a fact that you can rewarm it, then that's the time to do it. Because if you the more tissue that you damage with frostbite, a lot of that is lingering. So people who've had bad frostbite previously, even though they didn't end up with any amputations, they might have bad sensitivity to the cold, but also they might have pain, chronic pain related to it as well. So circulating water baths, and if you want details on what temperature it is and all that type of stuff, let me know in the comments. But we do have our hypothermia guide that just launched this month. That's really awesome. I spent over 2 weeks working on for our students and updated everything for 2024. So if you want that hypothermia guide, comment hypothermia. Yeah, that's the temperature that Celsius and Fahrenheit become the same at -40. Yeah. So this is your time, guys. I know there's a handful of you people who are interested in outdoor survival. You might be coming here from the alone experience. You may want to talk about something different. So let me know what you guys are interested in. This is your time. I'm here for another like 20-ish minutes, and then I'm going live with another special guest. So stay tuned for that. Let me pull up their YouTube so you know which channel to hop on for that live session. So it is, where did she go? There you go. So it will be with Rogue Preparedness. Let me double check to see if their YouTube channel is the same tag. And this will be with Morgan, who's awesome, and one of our new students. So Rogue Preparedness is, we're going to go on a live interview with them at 7 p.m. Eastern Standard Time and 6 p.m. Central Standard Time. But yeah, Alone and Canadian Prepper brought me here. Awesome. Welcome to the channel. Yeah. Um, Let me know, what about Alone draws you to that channel, and Canadian Prepper as well. What kind of topics most intrigues you? And if you were to learn one life-saving skill, what would it be? What would you want to learn today? And yeah, be curious, because we are just about to finish the first stage of our program, our online program. We're almost done all the medical emergencies that you typically see in a trauma. And all the next stuff are specialized skills that our students are going to be learning. All right, awesome. Carlos from Alaska, or is that Arkansas? Previously, when I got hypothermia, I was very confused and I did silly things, didn't get in a sleeping bag with fear of getting it wet. So that's hypothermia for you. So one of the first things that you should be noticing is that you may be a little sluggish, you may be shivering, you may be a little bit irritable. You may be really unmotivated in doing things. Once you get a little bit confused, it gets dangerous because you don't know how to appropriately manage yourself or to treat yourself. So that's why the buddy system is so important on cold weather expeditions, or if you're stuck in a cold environment. You need to be checking in on each other, seeing if they are coherent. Because if they are acting like a drunk sailor and making no sense, they got to be actively rewarmed, especially in survival situations. Shivering is such a good body adaptation to generate heat. Do you know how good shivering is? Shivering, the amount of calories or amount of heat degrees that it increases your body is the same as if you were to get into a sleeping bag and go skin to skin with someone. Crazy, huh? So, if you are still able to shiver and you have a sleeping bag, it's the same as shivering in that sleeping bag and warming yourself up, as if a person who'd go skin to skin with you who's already warm. And that's pretty mind blowing. There's some research on that as well. And one of the big reasons is that people who can shiver but get into the sleeping bag with someone, or someone who's warm who gets into the sleeping bag, the first person who's really cold stops shivering, and that whole rewarming process is just that body heat. So it's a really effective process. But if you are confused and cold, one of the things that follows that is getting sleepy and getting a little comatose, and it is not uncommon to do wild things. When I was in the military, operating and training in sub-zero temperatures, like as cold as -60 and below, so it's like -60 with the wind chill, people got cold really fast, and these are people who may have zero experience with the cold. And we had soldiers who were like over 200 pounds, super muscular, like 6'2", with machine guns, and sharp things that were confused like that, were kind of a little combative as well. So it does take some skill to not only identify that, but to calm that type of person down, to get them in a shelter location and to get them rewarmed. And one of the best things that you can know how to do if you do cold weather stuff, or even if you want to up your game to make sure that that hypothermia problem doesn't happen to anyone you know or care about, is to know how to make a hypothermia wrap and to do that really well. Another awesome question over here. How do you treat blisters when wearing heavy snow boots? So the best thing for blisters is prevention. We'll talk about treatment as well, but prevention's key. So one of the things that you can do to prevent is having boots that don't have a lot of friction to it. So if it's too loose for you, you don't want that. So test out your boots. In the wintertime, you're not having really tight boots. You want things to be slightly loose. But even with that slightly loose boot, you don't want things to have a lot of friction. And if you're noticing that you're getting some hot spots, you want to be treating that immediately. So, a few tips for you is if you have moleskin, it's tape that helps with the friction. You put it immediately on it as soon as it feels a little bit warm. So, don't be afraid to say, like, hey, I'm just going to stop and check my feet. You should be doing that fairly regularly because once you have blisters, it typically gets worse. And if you don't have moleskin, some duct tape does help. So, it's smooth when you're walking in that area and it protects that area's skin because ideally, you don't want to be popping blisters, whether that's from burns or frostbite or friction. You don't want to be popping blisters because that introduces the outside world with the inside body, and that could lead to infections as well. This is very important, especially for long-term survival situations and long-term hiking or expedition. So if you're like walking the AT trail or something like that, so prevention super key. Now, for frostbite specifically, it's hard to determine the depth of frostbite by just initially looking at it. You just pull up your gloves and say, "Oh, it's a little cold," it might be a little waxy and numb. Maybe it's just a superficial frostbite, but in a few hours it can totally change and look a lot different, like almost like a balloon of blisters. But one of the things that if you do see this, then it is a really, really bad frostbite, and it's fairly deep. So beyond the level of the skin. And that's when you see blisters from frostbites that are blood filled. So you really don't want to pop those if you can, because if you do, when you if and you probably would, especially if it's in your foot, if it does get infected, it is a deep infection. So you don't necessarily want to be popping those blood blisters. Now, if it is something that is hindering you from walking, what I would do, there's kind of two ways to go about it, and it really depends on what kind of tools you have and what kind of comfort levels you have as well. So, a simple way is you clean the area, clean your instrument, pop a little hole of it, and take out all the fluid. Bandage that, put a little bit of antibiotic ointment on top of the puncture area, and then bandage it and protect that area from additional friction, and then you can evacuate. So I would only do this if it's preventing you from evacuating and getting to a hospital for further evaluation. Now, if it's like a long-term thing where you have time to kind of rest, time to recover, a lot of the recommendations is selectively de-roofing some of these blisters that are causing you issues in mobility or function or survival capabilities. So the whole thought process behind the most recent research, and it does fluctuate between pop or no pop, but the most recent research is saying if you are going to pop it, to take off the whole top of the skin, so that bacteria, if it does get in, it's not just trapped in there, and you can treat it and watch it as a regular wound. So a lot of the times the skin on the top is not really sensitive, but all the skin under it and around it is quite sensitive. So it also depends on what your patient or what you can tolerate as well. So to de-roof it, you're basically puncturing, letting some of that stuff drain. You may have some tweezers that you can pinch up and tent, and you're basically cutting all around that dead skin so that on that raw blistery skin, you can put some ointment, antibiotic ointment, and a bandage on top of that. So that's one way to do that. But if it's too painful, then you're out of luck there. So, Carlos, excellent question. Is there any way of telling you're getting hypothermia before it gets bad? Yeah, there are definitely mild symptoms of hypothermia. So, you might be chattering, you might actually just feel cold, and you might be getting a little demotivated. So, as soon as you feel your cold, feel your shivering, that's a time to, in your back of your mind, what can I do to warm myself up? Where can I go to seek shelter? Because if you wait that much longer and you get confused, that's a problem, especially if you're alone. And it's almost something that you can preemptively prepare for as well. We've seen people on Alone, I think it was Alone season, was it eight? It may have been eight, where someone was doing their best to prepare for a hypothermic event because they were going into the water to get something or to do something and then coming back, and it was probably pretty cold. But one of the things that they did is they set a fire, and they were stumbling and imbalanced, and that's kind of a telltale sign that hypothermia is kicking in to alter how your brain's functioning. And they're using the fire to like warm their hands and feet. Not the best use of a fire, because if you warm your extremities first before your core, very bad things can happen, and our students know that very well. So know how to treat hypothermia properly, because there are things that people often do that could potentially make things a lot worse, and that's one of them. Ooh, great question. So Ryan saw a case where someone punched through the river, and how long could they potentially last in water? So everyone's a little bit different. Everyone may have a difference. Someone may have a difference in body fat, in different gear. I know my bibs have heavy insulation, but also flotation in it. So that's the striker bibs, best bibs that I've ever had. If you want to check it out, survivaldoctors.com/store is where I put it up for my recommendations. But those have a little bit of flotation, so you're able to kind of float a little bit, enough for you to kind of climb back onto the ice edge. But everyone's a little bit different, so I can't give you a definitive amount in minutes, but you can suspect based on symptoms. So if you are, let's say, coordinating the rescue and that person's like shivering but talking to you normally and trying to keep their body warm by like moving and trying to get up there, they're in a different state than someone who's already like sleeping and dozing off at that edge and getting that severe hypothermia. Yeah. Sometimes you got to sacrifice your equipment from being pristine to make sure you don't pass away from things like hypothermia. Oh, no way. That's awesome. Yeah. Let them know on Reddit that we are doing these lives, because I'm sure that they would like that. Hey, so we have someone who went to my medical school. Awesome. How's life after residency? It is awesome. I am here in Maine. So I moved here about a year and a half ago. We're just about settling in. and it's beautiful here. You got the ocean, you have beaches, you have lakes, you have mountains because I'm near New Hampshire as well. So it has a nice blend of things, and yeah, it feels pretty Canadian, especially in the northern parts, you know. So it's been nice. Yeah. How about yourself? What did you do after residency? Oh, actually, let me see. Now that I'm recognizing the photo, this was someone that I worked with in residency in clinic. Yeah, how is the clinic? Are you still working there? Awesome. Yeah, that collaboration was really fun. And for those of you who don't know, the Canadian Prepper, he's a YouTuber in the preparedness space, and he has an awesome shop. They deliver both in Canada and the US, but the types of stuff, I think it really caters to someone who wants that self-reliance. So they have things, everything from things that you might need for survival, like bushcraft, like food, freeze-dried stuff, but also things that I would personally want to upgrade my setups, like freeze drying machines. So if I could ever afford that, I would want one of those. Be a perfect gift. So if you guys have contacts in that, hit me up for that collaboration. I would love to get one of those for free and promote that. Ooh, this is such a good one. You guys have amazing questions. Keep them coming. This is your time to ask anything. Question is, if you get stuck outside for a long time and your feet get sweaty due to overdressing, can it turn into frostbite? Absolutely. So, sweat in the cold is your enemy. So before you even get a little bit toasty, it's always nice, especially if you're going on a hike or anticipating activity, to start cold or cool and layer on if need be. To give you an example, to give you a mental image of the types of clothes that you can wear when you're exerting yourself, despite the low temperatures, this is what we literally wore in the Canadian Armed Forces at sub-zero temperatures, like minus 30 degrees Celsius. So, to give you context, we are doing very physical activity. Our packs are at bare minimum 40 pounds. We have vests at times, which can carry water, our ammunitions, and we also have either a rifle. I was a light machine gunner. So we have at least 60 pounds of stuff on us. And with that, we're also pulling about 200 pounds between two guys pulling and one guy pushing, but mostly steering. So with that amount of activity, and it could be very similar to someone who does like winter camping, who's pulling a little sled behind them. With that type of activity level, we are wearing our base layer, our gloves, a neck warmer, a balaclava, and our wool beanie. And that's basically it, just like a base layer because of how hot we're getting. And our pants, our bibs, the zips are all the way down to our ankles and letting the heat release as much as possible. Because at that amount of exertion, you are producing a lot of heat. And just like even if it was a mid layer on top of us, you can be sweating through that. And the moment you stop, and if you don't have a spare set of clothes, which I often only pack 1.5 pairs of clothes because I wanted a lighter pack because I was a machine gunner and carried a lot of ammunition. Um, I would be very, very mindful of my sweat. When you're talking about feet specifically, sweating can be a factor of, it's just the way your feet are. You're a sweaty feet person, which no problem with that. But if your boots are too loose, there can be some friction there that causes some sweat as well, just extra heat from the friction. But one trick that I did learn in the military that I use often is I prepare my socks before expedition. So typically, socks is the only thing that I carry and pack that I have multiples of. I have like at least 3 pairs of them. And within the socks, sometimes if I'm anticipating a lot of probably sweaty or wet environments or a lot of exertion, what I do to prepare it is I have foot powder in nylon socks or silk socks, and then I put them in my wool socks. So I have a big, beefy, thick wool socks. And if there's any friction, there's not a whole lot of irritation with my foot because it has a sock that's very thin, and its main purpose is to transfer that sweat or that moisture off to the next layer. So the nylon sock or the silk sock transfers to the wool layer, so your skin itself isn't as sweaty. But second tip is if your boot gets a little moist, that's one of the reasons why I do recommend for winter having boots that have liners that you can remove, and having either a way to dry it out. So if you're planning on doing a fire, having that and one pair that's drying and another pair that you can replace into the boot. So on Alone Season 9, I dried my liners every single day so that the next morning they were bone dry. I never let that lapse. Yep. You sweat, you die. Steve, what's up? Steve from Alabama. A lot of my good friends are from there. I'll be in Gulf Shores to visit my in-laws not too far from now, probably in March. So awesome. Best investment was his dehydrating machine for long-term storage. Definitely would love to get that. One of the other things that I would like is a reverse osmosis water purification setup. It is kind of pricey, probably like anywhere from $1,000 to $2,000. But the issue in a lot of the places, and it's pretty scary because there are places that we have in Maine that I used to kind of bump around and camp in, that you couldn't even eat the fish or hunt the deer, not because they were endangered, but because there was so much chemicals and PFAS in the system that it was not healthy to eat that material. So I haven't tested the water over here for those types of chemicals because we are right next to our water reservoir on Sebago Lake. So we should have a decent clean water. But even still, there should be some traces of these forever chemicals. So with reverse osmosis, you're able to get rid of some of that. Ryan, but I have to leave, or Steve, before I leave, I want to make sure that you have some questions in here. So if you comment here, I'll just reply on the group chat, or if I have a moment, I'll say it right now. All right, Ryan, I find even if you have a tent or a stove or anything else, your base layer and sleep system should be your priority. Absolutely. Your sleeping system is like the holy grail that you protect. And one thing that I love incorporating in my sleep systems is a bivy bag. So whether it's a new age Gore-Tex or something like that on top of your actual sleeping bag to protect it from any wetness, moisture, um, punctures or anything like that, it is well worth the investment, and it increases the temperature of your sleep system as well. It's like putting a rain jacket over your puffer jacket. So really recommend keeping those clean, repaired, and having materials to do that. So always having a little repair kit with you. Ooh, alternatives to wool. So my first reaction is fleece. So fleece is synthetic and it still retains some R value when damp. So try some fleece out. And I would see if you're allergic to all types of wool, because maybe you're not allergic to alpaca, which is one of my preferred wools. The one that I wore on Alone Season 9 is alpaca, and it's super, super comfy, not itchy at all. Hey, if you can get me on with Les Stroud, who's also a Canadian, that would be awesome. I would love to talk to him about music, food, and survival, because he is a musician and just such a cool guy. I would love to meet him. Yeah. So Ryan's a plumber, and he was talking about the reverse osmosis. Yeah, and he's talking about the supplements that you would need to include into the water, the minerals and stuff like that. So I would much rather put into my water than to have water that's tainted with like chemicals and that type of stuff. So that's my personal preference. I do have daily vitamins and minerals that I take on the regular, and eat a fairly healthy diet too. Yeah, so that's a great point. So fleece does dry out a wee bit faster than wool. It's lighter, and in addition to that, um, it The only other thing that I would say is that it's the one downside is that fleece is not as fire safe as wool. So if you get one spark on it, it melts, and if there's a big spark on it, it can melt to your skin and cause some significant burns as well. Winter hammocks. I would love to try winter hammocks that are more flat. I have one that a patient of mine donated to me, but I haven't used them a whole lot because I do like the setup of tents. But I've only done hammocks in the summer and fall. But from people who've done winter hammocks, who I've talked to, definitely want an underquilt because a lot of that convection of air causes it to be really cold really fast. Yeah, I'm glad you found us too. I appreciate all of you for coming here. I'm gonna hop on to the next live at Rogue Preparedness. So if you don't follow their channel, follow their channel. They're awesome. And I'll be talking to Morgan in a few minutes. Thank you guys for all your amazing questions. Literally, like really amazing questions. And we do this at the end of the month, every single month. And submit your questions, whether it's on this page, on our private group, on Instagram, on YouTube, wherever you find me at Survival Doctors. And if you're interested in learning more about this stuff and going deep into these skills so you can literally apply this to save your lives and to save the lives of your loved ones, please reach out because our program is awesome and it's looking for more people to make it even more awesome like you. So thanks again. And I will drop the link in the comments, and also I'll drop it in the description. I'll put it right now, survivaldoctors.com. You should be able to find everything there, including the course as well. All right. So whether you want a field guide, that's free. Whether you want some training, we do have a 30-day free trial. Just reach out to me, comment, check out the links, and then I'll see you inside our private community. Take care, guys. Thanks for the amazing questions.